Hypotensive patients in the pre-hospital emergency setting represent some of the sickest patients that we'll ever deal with. A predictor of poor outcomes is hypotension, and in some cases, the defining characteristic of shock. Even as little as 10 minutes of hypotension has been associated with poor outcomes in high-risk patients. Some suggestions are to treat transient hypotension to stave off poor outcomes. Enter the concept of this weekly dose: push dose pressors, epinephrine. Bolus dose vasopressors refer to the intravenous administration of small, discrete doses of epinephrine to treat hypotension instead of or before an vasopressor infusion. So, let me show you. If you build it, do it right. Okay, what we're going to need is an epinephrine, a syringe just so that we can rob the needle off of it, and a new 10 cc flush. Alright, so let's get started building this up. So you would open your box, you're going to discard the box, we're going to discard that part. All we need is this, the 1 in 10,000 epinephrine. We're then going to open our needle up. We're going to unscrew the needle from the syringe. We are going to take out the flush. And what we're going to do is we are going to then push out 1 cc. So now you can see that we only have 9 cc's of fluid inside there. I take my needle and I'm going to screw the cap back on, or the needle on. Cap. Take the cap off, pull your needle out, jam it into the vial, and now I'm just going to withdraw 1 cc of fluid. I'm then going to recap my needle, shake it around, and now I have my 1 in 100,000, expel all the air out, my 1 in 100,000 epinephrine. If you give it, they may live. How much do we give? 0.5 to 2 milliliters per dose, and each dose contains 10 micrograms per milliliter. Push it to reach the MAP goal. Well, what is our MAP goal? In hemodynamic resuscitation, let's just find out. A MAP of at least 65 will provide adequate diastolic filling of the left ventricle. It will keep the heart functioning. So we don't want to drop below 65. We want to maintain at least a 65 MAP. The kidneys require a 65 to 70, and the brain, for critical perfusion of it, requires at least 40. So the goal for our hemodynamic resuscitation on all of our patients should be a MAP between 65 and 80. What's the onset time of this push dose pressor? Well, the onset time is 1 minute. So depending on several things, because it is obviously patient dependent on their metabolism and where they're at in their clinical course, really depends upon how well they're going to react to the epinephrine. But notice in our patient here that now their MAP is 75. If you give it, prepare to give it again. Now let's consider something. So you just gave 2 milliliters and now their pressure is 75. So now what? What are we going to do? How much should I give now? Repeat doses, 0.5 to 2 milliliters per dose, every 2 to 5 minutes. And again, it's patient dependent. Why not just hang a drip? You can do that, but push dose is faster to set up. How fast are you at setting up the pump? The pump is a really fantastic device, but in this situation, push dose epinephrine can be set up and built and moved on so much quicker. Well, what's the dose for an infusion? It's 2 to 10 micrograms per minute. 2 to 10 micrograms per minute. And in each milliliter of my push dose epi is 10 micrograms. And how much do we give again? Yeah, that's right. 0.5 to 2 milliliters per dose. So it's really close to what you're doing as an infusion. You can just stick with the push. It's a lot quicker. It's a lot easier. And now that you know how to build it, the chances of you saving that patient's life or staving off critical hypotension have just plummeted. And as a final suggestion, label it. Really, label it any which way that you can come up with to label it. Label it in a way that you can identify, or it can be identified as the push dose pressor and not just a flush. And it's not going to be mixed up with the other medications that you've put in a syringe of similar size. Now, as a final thought or review, push dose epinephrine is given in 1/2 to 2 milliliter doses. Each milliliter contains 10 micrograms of medication. This build right here is now your 1 in 100,000 concentration of epinephrine. Remember that it's built with a 1 in 10,000 epinephrine. I hope that this was beneficial to you. I hope that you learned some stuff, and I hope this empowered you to use your skill as a clinician to do even more fantastic for your patient. So, thank you for watching, and until next time, be safe.